The school year is also a time of year when it's increasingly important to be keeping an eye out for changes and people on our local roads. Among the hustle and bustle of school days and the changing seasons, Northern Health wants to remind everyone to keep pedestrian safety in mind. Here to talk more about the importance of pedestrian safety is Northern Health Medical Health Officer Dr. Ronald Chapman.
So during the school year, we want to make sure that the importance of keeping our roads safe for children isn't lost. The reality is that across Canada, pedestrian injuries are a leading cause of death among children and youth. And every year, more than 30 children are killed and approximately 2,400 are seriously injured. And while more pedestrian injuries occur in urban areas, those in rural areas tend to be more serious and are more fatal. In September and October are particularly bad months for rates of pedestrian injuries in children, especially between 3 p.m. and 6 p.m. in the afternoon, when most of these injuries happen. And research basically suggests that it's likely a combination of less visibility related to shorter days and less daylight, and more pedestrian activity on roads as children walk to and from school.
Joining us to share some tips for improving pedestrian safety is Lynette Hewitt, Injury Prevention Coordinator for Northern Health.
So 3 key issues around pedestrian safety are vehicle speed, supervision, and education. I'm sure we've all been driving through school zones and 30 kilometers an hour seems so slow, but for a child it really could mean the difference between life and death. If a child pedestrian is hit at 50 kilometers an hour, they have an 80% chance of dying, but that same child hit at 30 kilometers an hour has a 95% chance of survival. So we're asking people, please slow down in school and playground zones. 30 kilometers an hour really does make a difference. So as far as education goes, we really want to encourage parents to start their children at a young age, start teaching them how to cross the road safely, come to the curb, look left, right, left again, and then cross when it's safe to do so. A couple other pointers is to try to encourage children to learn how to use their ears. Just because they don't see anything doesn't necessarily mean something might not be coming at them from behind that they haven't seen. Also to make sure that kids are taking out their earbuds before they cross, turning off cell phones, things like that. So as far as supervision goes, children under 9, we encourage parents either to walk to or from school with them or make sure that they're with an older, more responsible child. Children under 9 typically don't have the developmental abilities to judge vehicle speed, figure out how far away the vehicle is or how fast it's coming, and to choose safe gaps in traffic to cross. So we really want to make sure that younger children are paired up with either older children or adults. So having parents model safe pedestrian behavior is also really important. So any opportunity you have, especially with younger children and as they grow older, become more independent, take whatever opportunity you can to walk with your child and talk to them about traffic safety and what's safe and what's not, and how to cross roads appropriately. So whether you're a driver, a parent, a teacher, a concerned caregiver, or a child of any age, we all have a role to play in keeping our children as safe pedestrians. If you have an interest in learning more about how to make your community more walkable or how to increase pedestrian safety around your school or organization, Safe Kids Canada is www.safekidscanada.ca. Has a lot of really great resources that can help with whatever project you choose.
We all have a role to play when it comes to pedestrian safety. So let's work together to keep our streets safe for traffic of the non-motorized variety. For more information, you can visit the Northern Health Injury Prevention page at www.northernhealth.ca under Your Health. Or you can visit the Safe Kids Canada website at www.safekidscanada.ca. For Northern Health Highlights, I'm Erin Collins.